Hi, I'm Rachel Campos Duffy, and I'm here with Daniel Garza talking about healthcare. We're going to get right into it, Daniel. What do Americans want in their healthcare?
God, thank you, Rachel. It's an honor to be with you. Look, to see our doctors of choice conveniently and affordably, to have access to the most appropriate, safe, and effective treatments. That we want access to good insurance that meets our needs, but it is also affordable. And then to know, how much our care is going to cost. We don't want any surprises. And so, look, we need to make informed decisions as a community of Latinos. And because I think of the nature of our community, the safety nets, we need to strengthen them as well, and to protect the most vulnerable. Rachel, a lot of families are hurting, especially during this time of pandemic and economic recession that's been artificially imposed by these restrictions. And so healthcare has become a massive priority for us.
Absolutely. So, how do we improve healthcare and its delivery, especially as it relates to the Hispanic community?
That's right. Look, it's gonna what we can do to make this happen are essentially four things. It's going to be expanding access, and we talked about that, reducing costs, ending surprises, and strengthening the safety nets. To make this happen, Rachel, we cannot be promoting a public option, a Medicare for all. We need to promote a personal option. It literally is like going into a grocery store and just throwing everything in your shopping cart that is recommended to us by the doctor, because we don't know the price. And then we get to the checkout stand and then we're blown away with the price. Well, it didn't matter because you have a third-party provider like Medicare, Medicaid, or even your insurance that presumably is going to pay for it. But for a lot of folks, there's a certain percentage that you got to, pay up front or pay the cost at the end of the bill. And so it spikes up the cost for healthcare for so many folks. But we can address that, and we need price transparency. We need truth in advertising. And then, of course, we need to repeal those mandates that have been imposed by the Affordable Health Care Act that incentivizes insurers to deny access to doctors and hospitals via these very narrow networks that are most of the time more expensive, or actually can restrict us from having Spanish-speaking doctors that many of us in the Latino community need, Rachel.
Are you talking about being able to price shop for insurance across state lines, for example?
Well, that's exactly right. You would have a better system that actually provides you the information that you need, and also that way you could choose the doctor, choose the clinic, choose the healthcare provider of your choice that is going to be more convenient, more affordable for you. And then, of course, you won't have sticker shock at the end.